This evaluation plan is for the Cobb County Safety Village program located in Marietta, Georgia. This is presented to you by Elizabeth Dilling and Alyssa Ignore. First, let's discuss a brief overview of the program. The Safety Village programming encompasses a wide range of safety issues affecting the community. This community-based safety program targets Cobb County residents and focuses mainly on its children and safety topics which affect them. The mission of the Cobb County Safety Village is to provide the highest quality safety education and training available to enable Cobb County citizens to help and protect themselves and others from accidental death, injury, and destruction of property. Overall, the vision of the program is to build a safer community through education and advocacy. The program believes that by reaching out and teaching important safety techniques and by providing guidance on crime prevention and doing all of this through a unique hands-on experience, it will teach and train participants how to react in dangerous situations. In order to accomplish this goal of training through hands-on experience, the program uses a unique facility to teach participants safety skills. The facility is a mini version, aka kid-size replica of the Marietta Town Square, including roads, buildings, traffic lights, crosswalks, railroad crossings, and etc., to enhance the program through hands-on learning. It also includes a small lake and a house to use for water and fire safety. As you will see later in the logic model, this program includes a wide range of activities which are intended to educate the community. For the purpose of this project, we will focus on the programming related specifically to elementary age children. We will focus on the parts of the programming intended for 2nd and 4th grade students who will attend a field trip at the Safety Village during their time in these grades. As part of the public school system, children receive a free field trip to the Safety Village, and then educational materials and programs are provided at the schools in the other grades. We will break down the program and focus on 3 key parts of the program presented at these field trips. We will plan to evaluate the bike lesson presented during the field trip, the helmet fitting presented during the field trip, and the Safety Village itself and how it is utilized. Now we will address how our evaluation plan will work. First, we will be evaluating a short-term outcome specifically addressing the students or participants of the program and its effect on self-efficacy. Next, we will be evaluating an activity specifically addressing the curriculum and the quality of the lesson. Lastly, we will be evaluating an input specifically addressing the facility and how it is relatable to its target audience. As you can see from this logic model, there are numerous outcomes that want to be accomplished from this program. First, some of the long-term outcomes include reducing bike-related injuries and deaths in children, reduction in fire-related injury and deaths, reduction in childhood drownings, and lastly, reduction in child pedestrian-related injuries. There are several outcomes that are intermediate and short-term as well. We have chosen one short-term outcome to evaluate. We will be evaluating an increase in knowledge and self-efficacy and proper bike helmet usage. Next, as you can see, there are several activities that take place in order to accomplish this goal. The activities of the program include developing and maintaining safety communications, teachers and Safety Village staff coordination of field trips, hands-on bike lessons and a fitting lesson for bike helmets. This will be our next point that will be evaluated. Next, experiencing a proper way to escape a home fire, make a home fire escape plan, practice smoke detector maintenance. Also, hands-on water safety instruction and proper life jacket use lesson, and to practice proper pedestrian safety and road crossing safety on the course. Lastly, as you can see, there are numerous inputs that go into this program. Funding sources from grants, donations, and government money, community partners, trained staff, firefighters, school partners and teachers, Safety Village facility, including the firehouse escape house, the road course, and the mock lake. This will be our last area for evaluation. Other inputs include fire detectors, bike helmets, life jackets, and go-karts. In order to evaluate the 3 areas mentioned previously in the logic model as part of the program, we have developed 3 evaluation questions. The first evaluation question will be used to evaluate the increase in knowledge and self-efficacy and proper bike helmet usage. The question will ask, to what extent did the program affect self-efficacy for proper use of a bike helmet? The question which will be used to evaluate the hands-on helmet lesson and fitting will be question number 2. What is the quality of the bike lesson and fitting for children? Quality will be defined by how well the helmets fit the children's head according to the bike helmet rules provided by helmet manufacturers, such as 2 fingers above the eyebrow and no more than 2 fingers below the chin and strap. The question which will be used to evaluate the Safety Village facility, including the firehouse escape, the road course, and the mock lake, is question number 3. To what extent did the Safety Village portray a real-world experience? When discussing real world, we will be referring to the real world for the children, so similarities and closeness to their neighborhood and familiar items in their environment. These will be especially important when discussing topics such as crossing the street in a neighborhood in the suburbs versus in a city or in a rural area. How true does this facility replicate what the participants see in their neighborhood, making it real world for the participants? The design for question number 1 will be a pre- and post-test comparison with no external comparison group, which will be used to evaluate if the program was able to build self-efficacy of the children and the proper use of a bike helmet. Because the field trips are planned in advance, the children will be given a primary test to determine a baseline a month before the field trip, which will be used to compare the data within the group. Another pre-test, the secondary test, will be given upon arrival to the Safety Village. And finally, a post-test will be given about a month after the visit to the Safety Village. We will use the first pre-test data as a comparison group to determine if self-efficacy was increased due to the lesson. The post-test will be given after the program is completed. We will also utilize an observational checklist to determine the children are putting on the helmets correctly and are participating in practicing these new skills. Interviews and questionnaires will be used to determine if the children felt that they could utilize a bike helmet correctly within a month of the field trip. The data collected through the observational checklist will provide the number of children who can use a bike helmet properly and the number of children who confidently use the bike helmet without asking for help. This data will be collected by teachers and chaperones observing the field trip. Interviews will be conducted by evaluators to measure competency in using the bike helmet and how confident participants were in knowing the proper way to use a bike helmet. Questionnaires will be used to collect data on the extent to which self-efficacy improved after the participants go home and try to use a bike helmet alone. For our second evaluation question, we will utilize a post-test design and mixed methods to collect data that includes observational checklist, quick exit surveys, and observational assessments. This will help determine the quality of the bike helmet lesson and the fittings of the bike helmets. Quality will be defined as how well the helmets fit the children according to bike helmet rules provided by manufacturers and how well the children can properly fit them on themselves. Utilizing observational checklists, quick exit surveys, and observational assessments will help us determine if the helmets are fitted properly and if the children receive a bike helmet to fit them when the lesson is completed. Through the use of observational checklists, data will be collected providing the number of children who are fitted for a bike helmet. With the use of observational assessment, data will be collected to assess if the bike helmets were fitted properly to the children's head and if the bike helmets were available to fit each child. Trained staff who are knowledgeable in proper use of bike helmets will be collecting this data. Quick exit surveys will be completed by teachers to collect data on the number of students in their classes who received a bike helmet. This will provide data on the number of participants who had helmets available in their sizes and were able to utilize the lesson. The third evaluation question looks to determine how the Safety Village represents a real-world experience for the students. Our design for this particular question includes a post-test design and qualitative methods which include interviews and observations. Because the children who visit the Safety Village come from different neighborhoods and types of living situations, our interviews will focus on how the Safety Village represents the differing neighborhoods. Our interviews will focus on interviewing adult chaperones from the field trips to determine what parts of the Safety Village are most similar to the neighborhoods they visit from, what parts are least similar, and the quality of the course and equipment. Interviews will be conducted with the children participants to collect data as well on how closely the children feel the Safety Village is familiar to them and looks like their neighborhood. Teachers will make observations of the Safety Village and provide data on how closely the village represents the neighborhoods near the schools where the children attend. Lastly, teachers will report data from observations about the quality of the course and structures in the facility. The observations will provide data to determine the extent to which the facility portrays what the children consider real world, along with what teachers and adults report are similar to their communities. Several methods of data collection will occur throughout the course of the evaluation. These will take place prior to the field trip, upon arrival to the Safety Village, at departure from the village, and finally 1 month from the field trip. As you can see, we have included several methods of data collection. First will be a pretest and questionnaires. Next will be, upon arrival, observations, pretest questionnaires. During the lesson, observational checklists and observational assessments will be made. At departure, quick exit surveys will be completed, and 1 month after the field trip, interviews and post-test questionnaires will also be completed. Lastly, we will discuss how data will be disseminated and evaluation results will be sent to stakeholders. The evaluation stakeholders will include the funders of the program, specifically the hospital system, individual donors, and grant providers, along with volunteers and staff providing the programming. The stakeholders also include the school system employees who support the program and teachers who provide additional education from the program in their classrooms as a follow-up to the field trip, and will assist in collecting data while their students are participating in the program. The funders of the program, the Safety Village staff, and the school system employees will be included in the annual meeting after the completion of the evaluation. The volunteers and teachers will not be included in the meeting, but will receive a final report and will also be involved in the implementation of the evaluation through data collection. To disseminate the data collected, quarterly meetings will take place throughout the school year with specific key stakeholders who are involved in the implementation of the program so that changes can be made as needed throughout the school year as additional schools send their children to the Safety Village. These quarterly results will be presented in a group setting with a PowerPoint presentation, printed materials, and time for discussion. After the evaluation is completed in its totality by the end of the school year, a complete summary of the results will be presented to stakeholders as mentioned. The funders and school system employees who are involved with the Safety Village staff to incorporate these programs in their counties. The final results will be sent as a report to these stakeholders for review, and then an end of the evaluation meeting will take place to present results and discuss the effects of the program. Thank you for listening.